Welcome to the first of several educational videos that we're going to present to you while you're a patient here at Southern New Hampshire Weight Management. To refresh some information we've talked about before, patients qualify for bariatric surgery if they have a body mass index over 40 or if they have a body mass index over 35 and they have several different medical conditions, including diabetes, hypertension, or obstructive sleep apnea. Some people shouldn't have bariatric surgery, and patients who shouldn't undergo surgery are patients who are too sick to do well with surgery, patients who have uncontrolled medical conditions, patients who have uncontrolled mental health disorders, or patients who have eating disorders. Now, it's not to say that you can't have surgery if you have some or any of those conditions, but we have to make sure that all of your medical and mental health conditions are well controlled before we think about proceeding with an operation. Also, patients who are using tobacco or nicotine products, vaping, or using other recreational drugs need to discontinue the use of those medications before they think about weight loss surgery and really need to stay off them for the rest of their lives. Finally, patients who are unable to exercise shouldn't undergo weight loss surgery because they won't really lose much weight, and there's no point in exposing yourself to the risk of surgery if you're not going to get the benefit of weight loss. After weight loss surgery, there are a bunch of things you have to keep in mind. One is that you're going to be on lifelong vitamin supplementation. Another is that you need to stay off of tobacco, nicotine, vaping, or other recreational drug for the rest of your life. You're going to experience regular follow-up care on an annual basis, so you'd expect to have an annual examination, an annual blood work, and you're also going to need to put in lifelong effort, and this includes making good dietary choices and remaining physically active. And that is the key to long-term success. Patients who don't take their vitamin and mineral supplements after surgery will develop deficiencies. And if you develop deficiencies, that can lead to irreversible problems such as anemia, osteoporosis, or neurological injury, including injury to your peripheral nerves that can give you numbness or weakness in the arms or legs, or memory loss. A word about alcohol following bariatric surgery. Generally, we recommend that you cut down on your alcohol use before surgery and that we recommend minimal alcohol use only on special occasions after surgery. You have to keep in mind that intoxication occurs with a much smaller amounts of alcohol after weight loss surgery, and that puts patients at higher risk of driving under the influence violations if you have even one drink and then decide you're going to drive. You also have a higher risk of developing problem drinking, and the rate of alcoholism following bariatric surgery actually increases. And these are the reasons we recommend that generally you limit your alcohol use following weight loss surgery. Pregnancy after bariatric surgery is safe, but we do recommend that you avoid pregnancy for 12 to 18 months after surgery. Women of childbearing age should recognize that fertility is increased after surgery. Obesity is a major cause of difficulty with pregnancy, and weight loss very quickly reverses that difficulty and makes patients quite fertile. The other thing you need to keep in mind is that contraceptives can be risky after surgery. Oral forms are less effective, and estrogen-based contraceptives can increase your risk of developing blood clots in the legs called deep venous thrombosis. For this reason, we always ask that you speak with your primary care doctor or obstetrician before surgery about contraceptive options for you for the first year or two after surgery. Finally, keep in mind that it is safer for both the mother and the child to have pregnancy occur after the weight loss has occurred and the weight is now stable. So if you can give us a year or two to get to a healthy, stable weight, you're going to have a much healthier pregnancy, and both you and your child are going to do better. Also, keep in mind that there are long-term costs associated with surgery, and annually after surgery, you can expect to have a follow-up visit. You're going to expect to have laboratory studies taken yearly so we can make sure you're not developing vitamin and mineral deficiencies. And finally, you can expect that there will be a cost associated with your vitamin supplementation that you're going to have to remain on. Medication changes will occur before and after surgery. Prior to surgery, you may be asked to either change or stop some of your medications. Particularly long-acting medications or XL or ER or SR forms need to be converted to immediate release forms. This is a little inconvenient in that it's a lot nicer to take a pill once a day than it is 2 or 3 times a day. But long-acting medications aren't very reliably absorbed after weight loss surgery, and so you're better off being on the immediate release form. After surgery for the first few months, you're also going to want to be on only liquids, chewables, or crushable medications. And so you want to work with your primary provider prior to surgery to get those available so that after surgery, they're ready to go. We're going to ask you to discontinue certain medications, including some vitamins and herbal supplements. Nonsteroidal anti-inflammatories are the pain relievers of the class of ibuprofen, Aleve, Motrin, Anaprox, and you've got to stay away from those both before and after surgery. And finally, steroids and contraceptives also need to be avoided, particularly estrogen-based contraceptives. Now that you're entering the program, we have some expectations. First is that you're going to begin to modify your diet before surgery, and you're going to maintain a meal log so we can work with you to see where changes can be made. You also are going to need to develop an exercise or activity program and maintain an activity log so we can see how much activity you're doing and make sure you're slowly making improvements in this over the span of the few months between now and surgery. Finally, you're going to have to achieve some degree of weight loss. You'll discuss this with your provider based on your body mass index at the time that you enter the program. The amount of weight loss we're looking for will vary from patient to patient. But certainly anybody who gains weight during the program won't be able to have surgery until they're able to achieve a steady or decreasing weight. And finally, we expect you to make your follow-up visits. Most insurance programs require somewhere between a 3 and 12-month preoperative process. And a lot of times they will set your counter clock back to 0 if you miss a month. So you really need to make sure you're making your monthly visits or you could make the process prior to surgery really drag out. In terms of dietary modifications, you're going to have a meeting with a nutritionist shortly, and we'll set some expectations and provide some education then. In the meantime, before that visit, you can start with the simple things. The first is eliminate beverages with calories. So you don't want to drink your calories. Everything that you're drinking should have 0 calories. Also, you want to start to eliminate unhealthy snacks. And these are things like pretzels and chips and cookies and cupcakes. You want to replace those with healthier snacks like fruits and vegetables and cheese sticks. Finally, you want to eliminate all fast food. No good food comes through a window. You just don't want to eat anything that you pick up in your car or go to fast food restaurants any longer. Also, we would like you to begin a meal log. And I want you to list everything in that log. At first, it might be a little embarrassing. You may feel like we're going to get mad at you, but we're not. What we're really trying to do is help you realize all the things that you are doing so that we can work toward improving them. So this isn't, nobody expects you to be perfect on day 1. We just expect you to work toward an improvement. And this is a proven tool for success. Patients do better when they log their meals. The next thing you need to do is start your exercise or activity program. And just remember, there is no weight loss without activity. Everyone can do some type of activity. If you were able to get into the office today, you're able to do something. A lot of patients have problems with their hips or their knees or their legs, or they have pain in their back, and it's difficult for them to do real strenuous physical activity. That's not what we're looking for. We're just looking for you to do some type of activity, increase it day by day until you're able to gain some strength and some stamina. Ultimately, I want you to work towards spending 5 hours a week doing something active and begin an activity log. Again, I'm not using this to pick on you. And at first it may be pretty sparse, but as time goes by, we should see a steady increase in the amount of activity you're able to do comfortably. To wrap it all up, I just want you to keep in mind that bariatric surgery is a tool, right? We're using this as a tool to treat obesity. Obesity is a disease, and right now the most effective tool to treat it is weight loss surgery. But weight loss surgery itself is not enough to get success. Weight loss surgery only works when you combine it with dietary modifications, an active lifestyle, and some behavioral modifications which help you manage high stress or high risk eating situations. When you take all of those and put them together, that's when you get success. Finally, I want you to remember that most people who have surgery can and will be successful in achieving and maintaining their weight loss. but it's not an easy process. This is not the easy way out. Weight loss surgery to be successful requires a lot of patient input, and it requires patient input for life. But I think you'll find, as most of our patients have, that the effort you put in is well worth the result. Good luck, and we'll see you in the office shortly.